Thanks everyone for joining me today. It's interesting doing this over a computer. I've not done this like this before, not since uni anyway, but yep, thanks for everyone for joining. So as it says on the screen, today's topic of discussion today is going to be on the exercises and the benefits they have on different neurological conditions. It's really interesting. A lot of the stuff that we do at HFRC is more acute post-op. It's interesting that a lot of people find that you have friends, family members that all suffer from, even it could be later down the track, or know of someone that suffered from a neurological illness or a neurological disease at some point. And they can stem from very simple-minded stuff to really complex situations and diseases that require a lot of attention. And very rarely do you see that people with these sort of conditions themselves have a single caring approach. There's multiple different specialists, multiple different practitioners, all involved in making their care appropriate. And with that, they have seen multitude of different people to help give them the best needs and help improve what they can as best they can for what's happening as well. And realistically, exercise can play a massive role in that in some form. Not to say it can cure or heal in any way, in any means, but it can provide some benefit, improve a lot of independence. And as we go and talk about some conditions themselves, some stuff that I've referenced to in some research studies as well, really pretty much articulate that as well, so we can see as we go forward. So just a list of stuff that we're going to talk about today. I always think it's really appropriate as an exercise physiologist, and as anyone probably would, talking about the benefits that exercise itself has on the body, no matter what the condition and what sort of stuff it does positively, that it helps. And what I'm going to do, I can pick and choose a bunch of things and have a whole presentation just on that alone. But the few things that I have kind of picked on and referenced will be more or less related to the stuff that we're going to see when we do some of the case studies, such as stroke, Alzheimer's, and Parkinson's, which I've picked just a few of. But with that, we'll also just briefly discuss some neurological diseases as a whole. And as I said, there's a mass variety of things out there that people can have. And with that, there's a bunch of different things that people can have and different symptoms, even if it's related to the same condition as well. And then we will break down those case studies. So starting off, we're looking at the benefits of exercise. So benefits of exercise. Exercise has a mass variety of physical benefits, as well as neurological and mental benefits, and also preventative factors for a list of different conditions themselves, all of which can help improve us as we age, and prevent some of these other things from creeping in as we go, and not necessarily related to neurological stuff, but I've kind of stemmed on that as we go through. So listing some of the physical benefits, we can help reduce our blood pressure. So pretty much soon after exercise, we do see there is obviously in some forms of exercise an increase in blood pressure, but post-operatively around that 1 to 2 hour mark, we do see a massive reduction to people's blood pressure, even if they are hypertensive or pre-hypertensive with some cardiac conditions. We really do see a reduction as they come through. And this can happen straight after exercise. And then over the course of weeks, as fitness begins to improve in these guys as well, we do see blood pressure slowly creep its way down on average as well, which is really good. Oh. Cool. So it improves and maintains muscle mass. So the biggest thing that we see people come through for exercise, if a lot of you guys that have come down in the past, it's helped you improve and maintain muscle. We want to be stronger. We want to actively age a lot better. When we start to slow down our exercises, or we start to, do other things, we do see that loss that happens very quickly over time. Usually over the age of 65, we do see a very much increased progression in the loss of muscle mass. So it becomes more of a maintenance factor, seeing people come through the gym, whatever form of exercise they're doing, whether it be aerobic exercises, whether it be resistance exercises, balance exercises, all you name it, hydrotherapy as well. In some way or another, we're stressing out the muscles, we're working the body in different ways, we're helping maintain, if not improve that, which will relate into other factors relating to health as well, such as falls, stronger joints, everything like that, all relates back to this muscle mass as well. And if we can improve it, the stronger we are, the more beneficial we are as we go through, and the more independence we can maintain as well. So that goes into balance and coordination as well. The physical benefits we see, when people, as they get a bit older, osteoporosis comes in, we're at more increased risk of falls. The stronger that our muscles maintain and the fitter that we are, the better our balance can improve as well. And we're a lot more confident in our feet, less likelihood of falls is going to relate to less fractures over time. And I think one of the biggest things that I see and is researched upon as well is the loss in balance and the mortality and the morbidity risk as well. There's definitely a relationship between the two to find that the less balance that we do have, or the less confident we are in our feet, the increase that we have on death, or at least major injury that may cause us to have even less independence as we go through. And then bone health as well. So I've been asked a heap of times about exercise and the different various exercise things that we can do, all related to bone health. And relating back to core muscle to balance, and relating back to muscle mass as well. We can see that improving bone mass reduces that risk of fractures, helps promote more active aging as we go through. So we do also see some neurological benefits as well. So it improves our brain health. So what we're doing is when we're exercising, we are obviously providing more, we're learning new skills, we're maybe relearning some old skills that we might not have done for quite a long time. We're promoting more blood and more nutrients into the brain as we stress out different things and learning new tasks. So it promotes all those sort of things that promote a healthy brain as well. Improves our sleep quality as well. So improved sleep, or having good sleep most nights, if not every night, it has been known to reduce a lot of improve recovery into injuries, improve recovery post-operatively, things like that. And it also has a massive go on reducing mental health ailments as well. Helps definitely reduce stress and anxiety. The more endorphins that we get, and the big thing you might hear from people that do exercise, it leaves us those feel-good endorphins post-operatively. I mean, it might feel not pretty good, it depends who you've got, but it might not feel too good at the time, but post-operatively, or post-exercise, those sort of feel-good emotions and those feel-good chemicals kind of come through. We're a lot more relaxed. We do generally are able to sleep a lot better as well, and overall promote a good healthy mind as well. And there is also some studies that do suggest it is good for memory too. Creating new connections, as we'll talk about a little bit later when we get into some conditions as well, improving those the way the brain works and understands. We do see a lot of times that memory itself can be improved, and if not maintained as well, especially for some of those people who do suffer from some of those conditions as well that may influence memory. And then the preventative benefits as well. So we do see it decreases the risk of cardiovascular disease, and that's the reduction in blood pressure. We're again a lot fitter, we're able to move a lot more, we're a lot more energetic, we have more energy. All these things contribute to a good, well-structured exercise program and helps improve as we age as well. Helps, some studies do suggest it lowers the risk of cancers as well. It continues with a healthy weight, lowers risk of diabetes, which again, for some of the stuff that we're going to go through is a comorbidity of people who do suffer from these conditions. Cardiovascular disease and diabetes is up there with some other things that these people have had in the past that either wasn't controlled very well, or something that kind of comes about as we go through and need to be factored into their exercise programs as well. And then, as I said, reduce the risk of fractures as well. Stronger bones, better balance, all relates to improving these things as we go through. So I did find a pretty nice little snippet, a little picture that does pretty much sum up of what I just said. Shows the immediate and the long-term benefits of exercise over time. Like I said, so you see sleep, anxiety, blood pressure, brain health, all those things that we can see with a good structured exercise program, and a structured exercise program that can be maintained as well. It's all well and good that we can do a single bout of exercise, but if we can't maintain it, we're never really going to hit those long-term benefits, which is what's going to help us the most as well. So that's where we got to have a good discussion with your physician as well to kind of understand and go through what's best for you. So next we go into neurological diseases. So pretty much textbook that I want to have a look at. This is what it says. So realistically, it's defined as an injury, abnormality, or defect which targets the brain and/or spinal cord, in which a person presents with disorders affecting cognition, which is memory, physical action, so movement of the body, and in some cases that we do see as well, some emotional changes, and that's personality, that's social stuff as well. You know, as these people progress in their disease, if it's not well controlled, or if there's not, and you haven't got the care around you, we do see those changes in personality, which I think for some people can be the hardest thing as well. And like I said, there's a mass amounts of different types of neurological diseases, and they range from different severities, they range in different symptoms, and it realistically just depends what part of the body or what part of the brain, the spinal cord, or what sort of injury took place to cause for these conditions to start to snowball as well. And there's obviously a heap to choose from, but again, the ones I've picked today are pretty much the most common ones that people know of, if not the ones that I've seen kind of come through our clinic as well. So to sum up, just some different types and different kind of subgroups and categories that you see of different neurological diseases. Stroke, which we're going to talk through today. Spinal cord injury is another one as well. So this can come from injury, accidents as well, and it can relate to even partial, if not full severing of the spinal cord itself. So not necessarily spinal cord injuries are always complete cut, or things people lose the sensation and lose everything lower down from that point. Sometimes it could only be partial. Sometimes it could be the way the spinal cord itself works and talks to the brain. There's different things like that all relate to these sort of injuries. The degeneration of nerves and brain cells, so dementia as a whole, but more specifically Alzheimer's is a big one, and another one that you can probably put on there would be Huntington's disease as well. All kind of relate to that degeneration of the brain cells themselves, where they're not getting the same amount of blood supply, but again, we'll go through that a little bit later. Cancers themselves that act on the brain and the spinal cord, more often than not that you'll find that if they're more severe cancers, they do need to be cut out. And there is obviously, even how good doctors are these days, there still might be a case of where you do lose specific parts of the brain, specific parts of the spinal cord, and there is going to be changes to the body that happen over time as a result of that. And then birth defects as well. So faulty genes from birth. Muscular dystrophy is a massive one as well, occurring in children as young as soon as they're born, and realistically, as these kids get a little bit older, they do tend to get a little bit a lot weaker, and they do start to degenerate over time as well. And there is also some factors that relate to genes as we go through with some of these conditions that we'll talk about. So starting off with stroke. So we might have all heard of someone who's had a stroke or has suffered from a stroke, and their level of recovery will be different depending on the person that you've spoken to. And over time, there's people that you might see come to the gym. There's obviously different people who suffer differently over time. Whether we can get on top of that early and get them back to what they were before, that's the case of what a bunch of different approaches and a bunch of different specialists are all involved in, especially with stroke, to get this person as active as they can be, whilst also trying to get them back to some level of independence and help manage them the best they can for them to be as safe as they can as well. So just to define stroke straight from the textbook, it's the interruption of blood supply in the brain. It prevents oxygen and nutrients to reach the brain tissue, causing for cell death. Okay, there's different types of stroke. All right, there's two main types, and there's also a third subtype as well that I'll briefly touch on, that I probably see a lot more than what the normal stroke would be. But the two types we've got is an ischemic stroke, so it's a blocked artery, and it's the most common type. There are two types of ischemic strokes that you do see. They are thrombotic, so that means that the vessel itself was clogged somewhere else, and it makes its way up to one of the vessels in the brain, clogs there, clots there, and then that part of the brain doesn't receive any sort of oxygen as well. That part of the brain does tend to die. And then the other type is an embolic stroke. So that was when the clot is a much larger, it more so affects larger vessels that lead into the brain. And with that, they blocks off a lot more regions and can be a lot more detrimental to health. And the mortality risk of these sort of strokes are related to ischemic strokes are a lot higher in most. And if not treated quickly, do cause a lot of death as well. It's a lot higher mortality risk as well. The other type of stroke that we see is hemorrhagic stroke. So it's a ruptured blood vessel. All right, these can occur in two ways again as well. These come from an actual rupture of one of the blood vessels in the brain. It can occur either on the brain between the skull and on the brain tissue themselves, but also it can occur internally into the brain as well. More so, there is more of a risk of people who suffer from hemorrhagic stroke. There is, again, a more increased risk of death there as well, because it is a brain bleed and it is a lot harder to treat quickly. And therefore, people who suffer from these sort of bleeds themselves do tend to be a little bit more, if they do recover and they do end up getting through it okay, they are a lot more dependent on other people, and their risk factors and their symptoms are a lot higher as well. Oh dear. There you go. All right, so this is the third one that I was talking about. So this is a transient ischemic attack, or a TIA. Realistically, it is a mini stroke, so there is many occlusion of one of the major blood vessels, causes for that decrease in oxygen supply to the brain. Temporary symptoms that do come, but the body does fine and the brain does tend to recover. And more often than not, there is a return to more or less all previous functioning again. There may be some loss, which some people do say they do still lose maybe a little bit of that peripheral vision. Sometimes the vision does get a little bit blurry, but more often than not, their balance, their cognition, everything does tend to return to normal quite quickly. And people usually deem this as a bit of a wake-up call to other factors that may have been an issue in the past, need to be brought forward now just to make sure we get them under control and prevent a further stroke from happening as well. Another big thing to kind of talk about as well is women are actually a lot more prone to stroke than men. And once a person has had a stroke, there is, in the first couple of days, if not the first couple of weeks, there is a very large, there's about 23% chance that a person may have a recurrent stroke. And that's why you see these people who have suffered from stroke, they need to take it quite easy. They're monitored daily, they're monitored hourly, to make sure there's no reoccurrence. And once they're deemed fit enough and well enough, they do go home. And then that's where the other services that we can provide and other specialists provide to help get these people back to where they need to be. So some risk factors, so some stuff modifiable, meaning that we can actually take control of this and help reduce our risk long-term. So being overweight or obese, so managing our diet, as I said, that exercise is a massive way that we can help moderate that. Being more active leads to healthier weight, improved aging as we go, reduces that risk of stress on the body, which puts stress on the heart, and the increased stress and being overweight and obese usually comes with poor diet. The buildup of those sort of plaque or those clots that do form is related to our diet as well. So a healthy weight does manage this really well. Another thing, biggest thing probably a lot, physically inactive, not moving the body, not stressing the body out appropriately, finds that there is an increased risk of stroke as well as we go. And substance abuse as well. So alcohol, smoking, other sort of drugs and things like that, even some medications as well, there has been a link to increased risk of stroke. So everything we need to find all kind of relates to previous, and we want to make sure everything's under control and everything's in moderation as well. And like I said, high blood pressure. So one of the benefits of exercise is to help reduce that high blood pressure. Constant high blood pressure with stroke does relate to higher mortality and higher risk of that stroke from occurring as well. So we want to make sure everything's under control, whilst that means that some people might require medication for more chronic high blood pressure. That's something we need to take into, but exercise does play a massive role in that as well, in helping and help improve. So some risk factors that are unmodifiable, so some stuff that we actually just can't control, is our age. The older we are, the more at risk we do get of having these sort of issues come through, and that just relates to overuse. There's always a decrease or an increase in blood pressure as we get older. There tends to be we tend to become more physically inactive as we get older as well. Not all the time, but it does tend to happen as we go. Race, there's also been some stuff that's linked to some people who have, I think it was near African American and some Asian cultures as well, some Asian race that are more at risk of stroke. And gender, as I said, women are a lot more likely to have an increased risk of having a stroke as well. So again, this is just a little picture that kind of snippets some of the stuff, kind of the two main focuses or the two main types of stroke that you do see. There's hemorrhagic on the left there that you see is just a rupture in the blood vessel in the brain that causes for blood to leak out, insufficient blood supply and a hemorrhaging, as well as on the right side you see the little clot forming up, whether the clot forms in one of the big vessels as you see at the bottom, or does it make its way up to one of the smaller vessels, and then that relates to the sort of symptoms that that person might have. So relating to symptoms, and again, this is something that you see that's quite different depending on the person, depending on the level of stroke. It also depends on what part of the brain that was actually targeted by the stroke and what sort of issue that those symptoms are going to present to that person as we go. So to sum it all up, we do see paralysis, which a lot of people, I think, when they hear a stroke, they do think, oh, there's a loss of some use of the muscles and some use of the body. So that can range from gross, so it's bigger muscle groups, all the way down to fine motor control as well. So really down to the fingers and the feet and the toes. There is a loss of memory. So there's a part of the brain that covers on both sides. If there is some sort of issue that relates to that, we do see that there can be some memory loss or some sort of confusion, which again, this relates. And I think the biggest thing that people find with there's emotional changes to someone's personality that you see, it's probably the biggest thing. It's losing its memory loss. You know, it's starting off quite mild, but it become quite severe, and it become quite frustrating for those people as well. For all of a sudden their mind's really good, and all of a sudden their body's not working the same way. They're not in the same headspace that they were. They can't remember things as quickly. You can really start to see people get a bit agitated and upset with that sort of thing, and you do see that change over time. In some cases as well, there can be speech difficulties and even swallowing difficulties as well. And this is, like I said, sometimes that requires a little bit more attention. There is a change of behavior or emotions, as I said. And then some people that they say they can have pain and dexterity. So people lose those sensations when the brain's not talking to the body the same way on the same side of the body. We either have, there's some limb pain that we can have, but most of the time people relate that back to a change of sensation, if not a lack of sensation that they find with relating to numbness in parts of the body as well that we've seen. So in relation to what we see, you know, if someone was to present with a right-sided have opposite or left-sided weakness, this is when people as well and how their body kind of reacts to things as well. Biggest thing that you see people who have had right-sided stroke is they usually have this left-sided neglect. So what that means is where we obviously are more, and they do tend to forget about their left side and lack the use of the left side. And it is a big reminder when you're talking to these people or you're exercising with these people that you want to enforce that they've got two sides. It's more beneficial to train things as we go on both sides as well, to get them used to using that left side to create those new connections again. Whereas if we flip it over and we have there's damage to the left side of the brain, it affects the right side of the body, and it can cause the symptoms of speech loss, sensory issues, and understanding language related more to what we see before. But there is usually, no matter what side of stroke, there is that memory loss, there is that loss on some sort of motor control as well. So prevention. So we want to try and as best we can to control high blood pressure. We want to try and control diet as well, as I said before, reduce the levels of cholesterol, which is mainly those things that kind of do clog off the issues in the brain. We want to help maintain a healthy weight as best we can, and regular daily exercise as well. So we want to try as best we can to get these people as active as possible, as daily as possible, whether that be one-on-one sessions with the carer, something that we can get them up and moving around as well if they are under care. That's what we want to do, something daily as best we can to restart some of those issues. Now, depending on their level of function is going to depend on what sort of stuff you can do initially with them. Then trying to get them as active as possible again is what we want to do. There's no issues with some people that we do see with stroke is to do some aerobic exercise. So that's our fitness. That's getting the heart rate up. Done on anything, or if it could be done on just as simple as walking down the road and back again. These sort of things that we see in activity levels, we see stronger, fitter muscles as well as we go. Biggest thing would probably be resistance training, so strength training. Muscle strength, as we see people who are a lot more dependent or who are wheelchair dependent as well. We do see that massive reduction in their leg strength. We see a reduction in their walking, reduction in their exercise. We want to try and retrain those muscles to work the same way and get back to where they were as best we can. Not all the time. Reduce that gap as best we can. Balancing gait. So there's obviously sensory issues as well as proprioceptive. Want to try and retrain their balance as best we can, return them to some sort of independence, whether it be with use of crutches, use with a frame, if not walking independently again as well. Again, it all stuff we want to kind of target and see if we can improve over time and overuse. Another big thing you'll see with people with stroke is tight muscles. Flexibility becomes a real issue as well. People tend to find that they do have quite a spastic pattern, they call it. And when a person does have a stroke, where their muscles get tense, everything just tightens up. So if we're able to stretch those muscles out over time, we're using more of the muscle, we can retrain that muscle to use a lot more and get them out of those bad habits as well, which again is just going to throw off symmetry of the body, more so in the legs. If we want to get these people walking again, we need them to have nice long muscles and match the other side that works well. So some functional improvements with graded exercises. So we do see a massive decrease in the risk of recurrent stroke. And this is more long-term after we've had those couple of days, those couple of weeks that people are more at risk of having an stroke. More regular exercise does decrease their chance of a recurrent one. We see improvements to their memory over time. We're creating these new skills. We're creating more nutrients, and we're creating a healthier brain by reinitiating some of that blood supply, recreating new skills. We see massive improvements in their mental function as well. And this is that term when we create new sensations, patterns to go over old ones, retraining the brain to work a bit differently to the point where one part of that brain was damaged. We'll have when we were younger, or seeing kids grow up, skills do refine the more we do them and the more regular pattern we do see as well. We generally improve their fitness and reduce their fatigue. There's a reduction in people who suffer from stroke. Their volume, their VO2 max, all their aerobic capacity, it does tend to go down. So if we can help promote active exercise with the combination of all the things I've said previously, we do see massive improvements over time with these guys, which helps improve their independence as well. And then that goes into independence, reducing risk of falls, more confident on your feet, less burden on someone else, get back to the regular stuff that they enjoy doing as well, which is going to improve their cognition and improve their emotional state as well as their physical state as well. So this is just stuff that I find. It relates to some of the stuff that we've already talked about, but this is a really nice study. And like I said, I'm happy to send things through to you guys as well as we go through if you guys want to take more of an in-depth read. But to sum it up, this study kind of backgrounds everything to do with stroke. It has its causes, has its benefits. It goes through pretty much, I think, 45 different studies that have been happening over a certain time. Looks at all their improvements, what they've kind of done, the best things that they've improved. And they did see that with the regular maintenance of exercise, more or less, if not all of one person's burdens or the loss in strength or cognition, there was massive improvements and significant improvements in these guys with graded exercises as well. And another one that I thought was quite interesting, because it is one that I think would be great if we could do. And again, it depends on the patient, depends on the person. In a controlled environment, it would work really well, is the use of hydrotherapy. So warm water on warm muscles helps reduce stiffness in those muscles. We're not worried about falling, or if someone's there to support and make sure that person's okay. Again, it relates to the person's independence at the time and their level of function. This study specifically, it looked at hydrotherapy versus land-based exercises, and it looked at measuring the person's ability to walk, their quality of walk, their speed of their walk, and some balance related some balance stuff as well. So what these guys kind of looked at were the individuals they looked at did have a stroke within the last couple of months. They looked at how they did regain some of that independence, so they were still able to walk decently. There was some balance issues there, but they still were able to move around, if not with a stick or with a frame at some point. It still required some aid and some care. But over time, over the course of, I think it was nearly an 8 to 10 week study, or an 8 to 10 week, they actually found that the hydrotherapy guys were able to do a 2-minute walk test, better quality gait, longer duration as well. And they were able to do a functional balance test, which realistically is using a wall, leaning forward as far as you can without losing your balance and stepping forward. These guys had a lot better and more significant improvements, whilst they did another test or another functional test where there wasn't really too much difference between the two, but there was improvements on both sides, which is really good to see. So relating to the next topic, again, is Alzheimer's. So specifically, it's a form of dementia, one of the most common types of dementia, or one of the most common types that we see people that have, who do have dementia-related symptoms as well. So it's the most common, makes up around 70% of all dementia-related cases. It's the degeneration of brain cells over time, causing for a reduction in memory or cognition, reasoning, and leads to confusion as well. So there is some different types of Alzheimer's disease. And again, this is one of those things that it's not a response to aging, although aging is a massive factor in this. You know, Alzheimer's is not a part of healthy, normal aging. It is an abnormality, and it is an abnormality that can be reduced over time. Now, in some cases, as we go through, there is that sporadic loss as well. So it's the most common that we see most people do have. Again, it's not fully understood why this thing tends to happen, but there again are risk factors that usually occur. And in Australia itself, this is about 2/3 of the population that usually have this form of Alzheimer's. So there is a 1/3 that get this from another sort of way. And it usually occurs in individuals over the age of 65. And then there is this familia. So there is this rare genetic condition that people do have, that people can be marked for, that we do see, and that usually is a lot earlier onset. So these people are usually around the age of 40 to 50, where things start to kind of, they feel that start to slip. But again, these things can be marked now and looked at a lot earlier. So treatment itself can be start a lot sooner, which can then improve over time as we go. There's no real cure for this. It does tend to happen, but the more healthy that we keep our brain, the more nutrients, as I said before, the blood supply, and the more nutrients we give to the brain, the more we can kind of offset some of this. And if we're continually learning as we go, we'll see these improvements come, and we'll see these sort of symptoms start to slowly make their way in a lot less than what we would if we were to just let things kind of occur over time and naturally. Now, we do also see that there is different stages of this disease. Is starting off quite mild. So we do see very little loss of memory. These people do start to feel, and they do understand that things themselves, you know, they start to misplace things. They are well enough understand that their mind's not quite what it used to be, but again, more often than not, it is very, very mild. And the rate of where this occurs and as it progresses does vary between person to person as well. But some people could be in this very mild stage for, you know, years and years, up to 5 years, for instance, as well. But then once start to speed up to the point where we start to need more and more people to do things for us, and relates into the more severe, as I'll discuss in just a second. But moderate as well, there understands there's a decline, as I said. Coping can be tough. So this is where you more or less start to see those emotional changes, where people start to get quite frustrated that they're not able to retain things as well as they did. They're misplacing things all the time. They're late to appointments. They also find that they're starting to find that they lose interest in a lot of the things that they once loved, whether it be socializing. Exercise is one of the things that people lose that interest in as well, and also seeing and socializing with other people. These are where the things start to slip, and then we see those changes in the personality as well as their how their brain's functioning over time as well, all the way to those advanced stages where more often than not the patients do become completely dependent on others to look after them, requiring aged care homes, constant carers to look after them. The daily tasks we've been doing for years become too difficult. And things start to really progress to the point where all they're really doing is just waking up, moving through their day, not doing anything else to help benefit themselves as well. And it becomes really hard when we get to this advanced stage to get people active. There is improvements that we can, but it's the willingness for these people that want to do these things that becomes really important as well, and really the biggest issue, I would say. All right, so again, this is just a bit of a snippet. Now, this is a pretty over-dramatic presentation of what a brain looks like normally and what an Alzheimer's brain tends to do, but it does kind of put into reference of what we've kind of said, where a normal brain would look nice and convoluted, you know, all the nice squiggly things as we see, they're nice and thick. It means more surface area for us to retain information. Nice full brain, and as we flick it over to the Alzheimer's brain, we see those convoluted sulcus, they call them, they're starting to go away. You know, they're a lot thinner. We're retaining things a lot less. And the hippocampus there that you see at the bottom, that's where all our memory is stored. So we see obviously there's a loss in all of that memory that we've retained over time. And what might look on paper that those ventricles look like they get bigger, so the blood supply that gets into the brain might look like they get bigger. That's not true. They're more or less the same size as you see on the normal brain, but because the brain itself has become a lot less in size, those ventricles just look bigger. And it's just to show you and put into like a more of a ratio of how much that brain has shrunk with a pretty advanced, and like I said, not perfect, but a pretty advanced stage of what an Alzheimer's brain does look like if left untreated, and if that person was to just kind of go about things without any help or any sort of care along the way. So exercise does help improve this, or else I wouldn't be talking about it. So some treatments that we do see, biggest thing that people have, or biggest thing that people usually associate with Alzheimer's, there is medications. So it is the best treatment for it. It helps slow the different crazy amounts of medications out there. They all do pretty much do the same thing. You know, start to feel their mind going a lot earlier, can get on top of early, delay the progressions, but whilst also incorporating other things. By modifying environment is for people who are in those early stages, even those moderate stages, who still might be living at home. Obviously a transitional period where people feel that they can still do the tasks they could do prior, but as graded enough where these things do become quite difficult to do and quite difficult, and they become more of a burden and a risk to them and other people around them. Prime example is probably driving cars, I think. People think, oh yeah, I've been driving cars for years, I can do that. Get in your car, completely forget, or start to go okay, and then obviously forget. So those are the things that we do. And a lot of times you see people who are going into the later stages of this. There is obviously that factor that they need to be put in a home to look after themselves. So they just don't become a burden on someone else, and they're safe. And they're safe in the new environment they're at, so they're not going to cause harm to themselves. And exercise is a good way to supplement into this as well and get on top of early. Maintains a healthy lifestyle, healthy weight, reduces all those things I was saying previously, and helps enhance mood and helps prolong some of that independence as best we can. That's the biggest idea and the biggest thing exercise has in relation to this. So how it can help. So depending on the level of stage, can be done under supervision or can be done independently if it's appropriate. Again, like I said, in the early stages, these people do have a lot of that independence still. They still able to do their day-to-day stuff, and realistically, they're only forgetting things every so often. But getting them active and getting them moving does help delay that progression into that moderate stage as much as we can. And like I said, it can take 5-10 years. In some people that aren't doing anything, it can take up to only a year or two as well. So in these early stages, and like normal exercise, that even we want to be doing with people, whatever the condition is, if it all minutes per week of exercise, ranging whatever sort of exercise it may be, whether it's aerobic, balance, stuff like that. We want to try and aim for 30 minutes a day if we can. Enough we can get on top of it straight away. And the hippocampus, as I said, that's all related to memory. The more we and the whole brain itself, we keep that brain size the way it should, we keep everything going, and we're delaying in size and that degeneration of those brain cells as I suggested. Keeps reasoning and learning skills sharp as well. And definitely improves sleep recovery. And that's what I said previously, recovery and better sleep does help promote a better recovery as well, and reduces those negative emotions or negative personality and those negative things person might feel. We can help reduce those with improved sleep and with it's in one of its own, no matter what part you want to start at. I usually start with the blue. Strong, we're working the brain, we're creating more blood supply, better connections, more refined connections, and lots less stress, and then we're retaining and keeping that independence and being a lot more socially active, which, and like I said, Alzheimer's itself isn't a part of normal aging. And then finally, what we're going to look at is Parkinson's disease as well. So basically, as we start into to look at Parkinson's, straight from the textbook again, we do say it's a progressive nervous system disorder which affects the muscles and their movements. Symptoms do begin barely noticeable. They become more significant. They have some more significant changes which require activity modification, daily exercise, and sometimes require care in some of the later stages as well. What Parkinson in itself is, it is the breakdown and death of brain cells. So the neurons that synapse between in the brain itself, they cause a reduction in the dopamine levels in the brain. Reduced levels cause for impaired brain function, which can impair movement and cognition. So dopamine is a chemical that's released constantly in the brain. It is the chemical that does help transfer messages and actions across different parts of the brain, and then back down into the spinal cord, out to the muscles, back up again into the brain. So everything is all controlled through these dopamine levels as well. Whenever Parkinson's does start to occur, although it does, again, as I said, it does start quite mild, as it progresses, we do see a reduction in these dopamine levels. There's blockages that do occur, which influence on how these dopamine and the rate of speed that the dopamine levels or the dopamine chemical can travel across the brain. And what that does, if there's a road, like as in traffic is, if there's a breakdown somewhere, there's a loss of one part of the body, it has to take longer to make its way to other parts, which slows the process down as well. So some of the causes that we do see. So realistically, it is something that we do see. It is degenerative. It is something that we do see as a fault in the brain sometimes. Now, it's known to have certain gene variations as well, so it may increase in risk of Parkinson's in some families. But again, it can something that can be marked and it can be treated a lot earlier. Realistically, it's the gene itself is a protein that builds up in the brain. And when the brain starts to go through its usual cleaning process to clean out as the blood comes in and out, this sort of protein can't be broken down well enough by the brain cells. And what it does is over time, it just starts to clog up, and it realistically starts to cause these issues a lot earlier. This protein itself and the buildup that we do see is what these things are called known as Lewy bodies. So like I said, it's a substance that clumps in the brain, has a specific protein which the body itself cannot break down. And then we do see that when we mark these, we see these Lewy bodies in the brain, and we can track to see the rate of that person's progression, as well as a role to help preventative and have some preventative mechanisms as well that we can help. And there's obviously medications that we can have as well to help mitigate some of those symptoms and help improve, more often than not, the dopamine levels in the body, which helps improve those connections. Cool. And this kind of relates to what I was saying. So, you know, this is a well and good little part of the neuron synapsing into this other neuron. We see the little blue dots meaning dopamine, and the little receivers receiving on the connection on the other side and transferring. You know, if we were to imagine there that one of those receptors was blocked off, or even two of those receptors were blocked off, you know, we're having or even a reduction in the levels of dopamine that we're having transfer through. And over time, as we see a more severe Parkinson's brain come through, we're having these less and less innervations happen, which can somewhat relate to some of those sort of Alzheimer's symptoms that you do see. And that's why some of the symptoms that you see cross over a little bit as well. But, you know, if you imagine that we're taking a longer time to transfer those systems or those actions where we need to be, we're taking longer to process, we get things start to slow down as well. So some risk factors that we do see. Age is one thing. So the older we are, the more at risk we are of developing these Lewy bodies. We do see an increase in Parkinson's related symptoms over time as people age. Sex as well. So it's been said that men are a little bit more likely to get this than females. Again, there's some studies that say things the other way, but at this stage, what we do find that men are a little bit more susceptible. There is some hereditary, a lot of hereditary related symptoms. So mums and dads, granny and grandfathers, there is that gene that, like I said previously, that may cause increased likelihood of this over time, and you can get tested for it, and you can get checked to see if this is something that may become more relevant as we get older. And somewhat that I saw in there and that was interesting was exposure to toxins. So there has been a link in the risk of exposure to certain pesticides and insecticides, or people who are in their gardens a lot, you know, treating all this sort of, I can't remember the name of it, but the stuff you put in your garden to help, you know, help promote good grass and good garden grow and all that. There is some related risks that people have found in the past that's related to some increase in symptoms as well. And when that gets into the bloodstream, all of that then goes into the brain. Those sort of things can help break down those receptors and reduce our levels of dopamine as well. But very mildly, the other three are probably the most important. So again, some symptoms that we do see. So more often than not, you'll see anywhere. More often than not, you do see it in the finer dexterity. So you can see them some more often than not in the hands. They do have these little resting tremors that they can't quite control unless they really focus on it in some later early stages, but it becomes more of a chronic thing that we see as we go through. And again, it's when there's just incomplete or constant incomplete actions passing through the brain causing these things to start to happen. Slowed movements, as I said. So if there's blockages in making an action occur, there's slower transfer of the work in the neurons in the brain, getting towards the muscles. Movements become a lot more slower and a lot more staggered. We see tight muscles. The muscles are always constantly, and this more relates to the tremors themselves, tight muscles that are constantly getting all this feedback come through, but at a lot slower, broken up rate. We're getting incomplete actions come through. These muscles get stiff, the muscles get sore, and they get tight. Speech changes, because obviously we do have muscles in the throat, muscles in the jaw. These sort of things can lead to slurred speech over time. Loss of speech in some later cases as well if untreated, but more often than not, it's slowed, it's slurred, it becomes a little bit more of a task for these guys to talk as well. Reductions in balance, as I said, you know, if we're having tremors, we're having asymmetry on the body, our body isn't quite able to adapt to the changes that we might have in whatever environment we're in, our balance becomes a lot less. We see those rigid muscles start to be a bit stiff on one side, maybe in comparison to the other, throws off our center of gravity as well. And we do see balance increases, loss of balance, and an increase in risk of falls as well. And again, that's just a couple that you see. You know, this is a real, like, again, a drawing of what some stuff that you do see. You know, you do see those lines just relating to some sort of tremors that you do see, you know, the slump posture, the loss of emotion in their face, which I think is quite an interesting one as well. You know, these people, they do suffer with trying to get the enjoyment back, I say, in life in some later stages. They find that in some cases when they're walking, they actually also try and reduce any sort of normal movement they have. So they walk quite straight, like they're marching. You know, their arms do not move at all. Like it's quite stooped over, and it throws off the balance as well, as I said previously. So what we can do is we look at some of the benefits of exercise. So what we can do is in some of these patients, we can help reduce the risk of other comorbidities such as heart disease, diabetes, and osteoporosis. Again, these do work hand in hand with some of the issues that we do see that correlate to some Parkinson's disease related symptoms, and things that need to be managed by other specialists, other carers as well, and factored into their programs. It's something that might occur for them, whilst also treating the Parkinson's. We can reduce their levels of side effects of medications. So some of these medications themselves, then no medication is pleasant to be on. Some of these medications cause side effects, drowsiness, loss of energy, you know, it's some heart-related issues as well. We can help mitigate some of these issues with exercise and get on top of some of the things that we can control, which is our level of exercise. We can help improve our mood, improve our energy levels, and become more active and delay these progressions, as I said. And there's various different types of exercises for that. Like I said, we improve our mental state as well. We're improving our mood over time as well. We're reducing those risk of falls. And hopefully, which is the biggest thing I would say for these people with Parkinson's, we're promoting longer independence. Later stages, we do require a lot of dependent care to help do some tasks, again, to help do some things that we may not be able to do ourselves, or we may cause harm to ourselves as well. We promote longer independence for those guys. That would be the most important thing. And I think that is something that we can take away from long-term use of exercise, and a thing that help will improve their mood and improve them over time as well. And I think it's the biggest thing to consider. With that, we see some different types of exercises. And again, we're not really limited to the type of exercise we have to do. In fact, I think a variety of different forms of exercise is also working the brain a lot more. And we've been combined different approaches, different modalities of exercise. We can help mitigate some of those issues and improve how our brain functions in different ways. So strength training is a big one. Making it challenging, progressive challenging, but within that individual's capabilities. And then with constant one-on-one use and then making things more harder as they go, as the body does still tend to improve no matter what, we can keep things and keep the brain working in different ways. Aerobic training as well. So frequent walks, probably the most beneficial. We can use bikes, but if we're going to stress out some balance related issues as well, within the person's abilities, we want them to be walking and more aerobically active. We don't require people to come and see a bike, have bikes at home at all the time. So getting them out walking daily, as well as and promoting good walking as well, is probably one of the bigger things. Promoting the normal arm swing, normal gait. That's what we want to try and encourage as well as best we can. We also see balance training. So again, relating to how we are when we're walking, how our exercises, we can do balance exercises to help reduce those risk of falls that we do see increase for individuals who do suffer from poor balance when and again, I really promote hydrotherapy. So hydrotherapy use, warm water helps relax, stretches them out. We're at less risk of falls. We might find if we're a little bit more in those later stages, doing some of those more functional exercises just become a little bit too difficult on land, or a bit too risky to do independently in land. We can do them in the water without that risk of falling over, without hurting ourselves, if someone's there to be supervised as well. And that's where I always kind of relate back to stuff with hydrotherapy. It should be supervised in some way or another, unless it's clear to do so at a local pool or by your GP, somewhere where at least if something is to go wrong or something wasn't to go right, you're at least protected in that regard as well. Another big one to do, another big thing, and I think this also relates to stroke as well, but doing dual tasks. So if we can combine balance and strength, we get that brain working whilst we're doing some form of strength exercises. We're constantly stressing the brain out in a good way, whereas we can then have the brain doing multiple different tasks at the same time, constantly improving those skills and developing those skills over time. We do see massive and significant increases into their cognition, into their physical improvements as well, and also related to balance. So a big common one I see when I was looking at studies is just combining strength, balance, or balance and walking or aerobic training. It's all the things that I've seen as we come down. Again, pretty crude little image. It just shows you some of the different sort of things. Like I said, there's no really limitation to what people can do with Parkinson's. Dancing, swimming, doing tasks based on the rhythm. Over time, there's been massive improvements to cognition as well. But realistically, the only stem of that is there's no real issue with doing whatever you can, and whatever sort of stuff that your specialist or your practitioner will give you to help improve. Whatever you see the improvements in, that's what we want to get. Backwards. Cool. All right, so some of the stuff, again, as I looked into some research stuff. So if we look at the first one there, which looked at levels of dopamine, and if we can do what specific exercises themselves helped improve levels of dopamine in the body, if not improved how they action, which is the biggest complaint or the biggest issue that we see with people with Parkinson's disease. It was in animal studies, all right, because they did have to look at the brains themselves and relate to these things, which you can't quite do in humans. They assessed two types of aerobic training, which was skilled and non-skilled. So non-skilled being simply rats running on a wheel, whereas skilled would be running on a wheel, but there would be specific obstacles that rat or something that would have to get over. whilst it's doing it. So it's not just mindless running. There is a bit of a cognition or a dual task component involved. They found that the rats that were on that skilled-based running, they had significant increases in neural pathways. They increased blood flow to the brain and increased their level of rate of dopamine production versus the unskilled group. Both groups still improved, but there was more significant improvements in that group that required more skilled-based training. And the next one looked at the exercise, pretty much all the symptoms that people have with Parkinson's, whether it be falls, their gait, strength, all related to that. And it was, again, a meta-analysis, so it combined a bunch of different studies. It looked at 25 different randomized controlled trials, so 2 different groups, assessing probably most likely, most of them were land-based training versus kind of nothing, or at least one of the other, where strength, it was either strength or whether it was aerobic. And what they did is they assessed their strength risks, their falls risk, their balance, and their gait. So everyone but one study found there was significant improvements to their gait speed and quality from the training, which included both strength, aerobic, and balance aspects. Only a select few in all those studies being a lot more physically active and independent following their treatment. Type of training, but what was best for improving function was a combination of studies found that they were able to combine different approaches, like I said previously, different stresses on the brain, improve their outcomes and their independence, and then they're obviously all the symptoms relating to Parkinson's as well. Now, that's all I've got. All right, that's a lot to take in. And like I said, everything's going to be recorded. All my details are here if you want to contact me or contact the clinic specifically and ask for me. If there's anything that people weren't sure of or just wanted those sort of to look into those research those articles more specifically themselves and ask questions, whatever suits, that's fine. I'm happy to answer anything. And then I just reiterate some of the services that we do provide if something that has caught your eye or something you want to take up a little bit more literally. We obviously do have our gym up in Nedlands, which most people are familiar with, but we do also do some work down now over at Melville. And the same goes with some of the hydrotherapy stuff. And as I said, the times and practitioner person may vary, but we also do that over locally at the pools over in Charlie's. And again, we also do have classes there over down at Hydro and down in Melville as well. So